Hi, I'm Donna from the Bartram Trail Branch Library and the St. Johns County Public Library System. And I want to thank the library system and the Friends of the St. Johns County Library System for providing us this venue to share this important information because October is Breast Cancer Awareness Month. Hi, Robin. It's great to meet with you again and talk about this important information. Welcome.
Thank you. It's nice to be here.
I know. Breast Cancer Awareness Month is October, and there is so much to know about breast cancer awareness. What's the first thing that I need to know about breast cancer awareness?
Well, the thing to know is that now with the screening methods we have, with mammograms, with regular examinations, the prognosis is so good. So even if you get that scary diagnosis, if you will work with your doctor, if you will follow through, it can produce a really good outcome. Typically these days, like I say, the prognosis is so good. So part of it, I think, is not to be afraid and to know that it's better to find out what's going on, take care of it, and go on with your life than, to fear and maybe end up with more trouble.
Well, I know that I've been doing monthly self-checks. Oh, I can't tell you for so long. And every time I visit any physician, they ask me if I'm performing this. And I know that there are even YouTube videos to teach you how to do it properly. And I know that that's really an important tool for women to use to set a date, an arbitrary date once a month, just to check and make sure that you don't find anything that you need to talk to your doctor about.
Yeah, and it's interesting. I know from years ago, we always thought of it as just a manual examination, but these days what they're really encouraging women to do is to look at yourself, to know what's normal, for you, so that even visually, a lot of the changes you may pick up as visual changes, change in size, change in color, any kind of puckering or change in surface texture, those kinds of things that you really have to look at yourself in the mirror and see those things. So some of that is really even just a daily kind of awareness of anything that might be new or different.
Well, that's interesting. That's new for me. So thank you for sharing that information with me. I know that there's a lot of different organizations, and we've talked about Wildflower Clinic before, and Wildflower Clinic is there. So I'd really like to share this website with you, which is Pink Up the Pace. And I understand they're a partner with Wildflower Clinic. So this year they're doing a virtual fundraiser, and I wanted to share that. They help fund Wildflower Clinic.
They help fund screening for mammograms, that kind of thing. So screening mammograms, diagnostic mammograms, even ultrasounds, biopsies, that kind of thing. They raise funds so that women who are either uninsured or underinsured have the finances, don't have to worry about how will I afford that. They can get those regular tests done to stay safe.
Well, that's really important for everyone. And I want to also share the screen for Wildflower Clinic so that everyone can see that website, which is also an important part of our community, and that will help provide care for women during Breast Cancer Awareness Month. And I think it's very cool that they have dental, medical, and community on their webpage. And so you can click on what you need to find the care that you need. But let's get back to our topic, which is breast cancer awareness. Every time I see Wildflower Clinic, I get so excited because they do such important work.
Well, thank you. Thank you. It is important. And, the reality is, if you aren't insured or if you're underinsured, you still need the same care as everyone else in the community. And that's why Wildflower exists, to be able to provide those services. And one of the things we do as outreach is trying to provide education. Right now, places to provide education are limited. So we really appreciate being partnered with the library to be able to share some of this information with the community.
We're delighted to be a part of this message and to be a part of bringing the community together, because St. Johns County is a large county and there are a lot of people in different parts of the county with different needs. So it's really great to pull together the people who need help, but also to pull together the volunteers and the people that can help provide the help. So perhaps this will be a venue where people will become aware of what the opportunities are to help in St. Johns County for our residents.
Exactly.
So anyway, Robin, one of the other things I wanted to talk about today is that when I'm screen sharing and showing you this website for Wildflower Healthcare, if someone needs to access this and they don't have access to a computer at home, they can come to one of the 6 libraries in St. Johns County and access a computer for free. And of course, as always, there's a phone number that you can call. So they can also get that phone number on this website. Let me see if I can get there. Oh, wow. Look at that. I just found the 2019 clinic report. Love that. That is fantastic.
I'd like to share just some basic breast self-awareness messages. The first thing really to do is to talk with your own family. Know what your family history is. A lot of times there may be history, and that may be an important factor to discuss with your doctor. And then share that information with the doctor and talk to them about, what your risk might be. If you're normal risk or if you're at a little higher than normal risk, they may want to proceed a little differently. As far as being screened, women basically should start at the age of 40 with a mammogram every year if they're at average risk. If they have a higher risk, the doctor may want to start at an earlier age. And then typically for all women, we'd like to have physical exam by the provider at least every 3 years, starting at the age of 20, and then every year at the age of 40, just like the mammograms. The other thing is just knowing what is normal for yourself, taking a look at yourself daily in the mirror, look at any kind of change that might occur, any change in size or shape, in color, in the texture of the skin, even dimpling or any kind of pulling, anything like that that looks new or different. If you have a site that has pain that isn't going away, if there is any kind of a change in that way. And of course, the traditional exam that we've all been taught through the years, to physically be sure that there's no lump, no change, no hard knot, anything like that. And we want to look not only at the breast, but into the underarm area. All of that is considered a part of the breast. And the last thing I would mention is making some healthy lifestyle choices. And a lot of these honestly relate to everything that's good for our health, getting to a healthy weight. And I will tell you honestly, we have an American image of runway models and that kind of thing. We're just needing to get to a healthy weight. And for a lot of Americans, even a weight loss of 7 to 10%, which means, if I weigh 200 pounds, that might be 15. So we're not talking runway model. We're not talking the size we were when we were in high school. We're just talking about getting to a healthier weight where the body can work better. And then adding some kind of regular activity. And, my suggestion to everybody is pick something you enjoy doing. Otherwise, you're never going to stick with it. So whether it's a walk on the beach here in St. Augustine or in some of the pretty green spaces we have, because we have so many beautiful areas in St. Augustine, walking your dogs, swimming, playing active games with your kids, whatever gets you out and gets you moving. Those all help with breast cancer prevention as well. limiting alcohol intake for ladies. 1 drink a day is considered moderate consumption, like a glass of wine or 1 mixed drink. Also trying to limit menopausal hormones. They're indicating, research shows that there is increased risk when we use those hormones. So sometimes they're necessary, but trying not to use them more or longer than they are necessary. And for younger women who are at an age where they're having their families, breastfeeding if they're able, because that does decrease risk as well. So all those are just kind of basic self-awareness messages that ladies need to understand. The one other thing I would say is breast cancer does happen for men too. So we were talking earlier about Pink Up the Pace. They pay for screenings or provide financing for screenings for both women and men if there is an issue or a concern.
Well, thank you. That is all really great information. Some of it I knew, but some of it is new to me. So I'm always happy to learn something new each and every day. I think that we've reached our message today.
Okay.
And I really want to thank you for your time and for the wonderful services that you provide for our community. And I look forward to speaking with you again soon.
Thank you. And if those who are watching enjoyed this and feel that it's helpful, please like, share, or comment.
Thank you very much. Have a wonderful day.